It's a system for the medical or clinic, hospital, organization. If you have a web browser, just click the web browser and you can access the system. And here is the login page of the system. The system has a user, a doctor user, nurse module, administrator, and you can add or specify the other user. And just log in, and I am logging as a administrator of the system. Then log in. Then now you can see the dashboard of the system, the new patient, the visited patient here. Then here is my profile picture, and you can change it. The module of the system: billing, patient management, room, nurse module, doctor, EMR. EMR stands for electronic medical record, user management, administrator, and report generation, and also the user profile. Then we will now proceed to patient management. So patient management has a link: add new patient, OPD, and IPD. So if the patient has a is visited to the hospital and she is no record in the system, just click the add new patient, meaning the patient has no record in the system, so we can proceed to patient registration. Okay, then here is the patient ID. Patient ID is here is his or her registration number or permanent number. Then click title, Mr. Then last name. Okay, okay. Middle name. Required fields has a sign of asterisk, mark asterisk, color red. Birthday. Age is automatically calculated based on here birthday. Gender, status, religion. So here is the parameters: title, gender, civil status, religion, and blood group. This is the parameters, and you can add or specify another parameters in the administrator module. Okay, blood group. Okay, contact information, mail address, other information, insurance company, ID, if the patient has an insurance company. Then click save. Okay, then the patient has successfully registered to the system. Then this is the patient master. Okay, now search Samora here, date entry today. Then click patient number if you had to view your information here. Attachment: the system can attach a file or picture, upload information of the patient, like medical record, x-ray here. Sample, I upload image. Okay, sample. The maximum size is 3 MB only. Okay, open. Description: For example, X-ray result. And upload. Okay? Attachments will be uploaded. Then you can click description to see the attachment. Okay? And patient master, this is the full complete patient data in our system, in our database. Okay. So Samora is a OPD patient, or standing for outpatient outpatient. So we can proceed to OPD registration. And OPD registration, and look for Samora. Okay. Sample, Ramon Butchong. Check in. Then this is here. This is his OPD number or visited number. Referral doctor, department, sample, statistics, and consultant doctor. Vital parameter, patient history, allergy, social history, family history, personal, and past medical record. Then if the form is completed, just click the save button, click OK. Okay, OPD patient already exists. Okay, sorry. Just look for another patient because Ramon Butchong is already checked into the hospital. Sample is Marisa Absalon. Okay. Check in, referral, department, consultant, save. Okay, OPD patient actually saved. Then OPD master or inquiry here. The patient management can view the receptionist or nurse. Okay. Status check in. Then we can log in as a doctor because patient is consultant doctor is George Gonzalez. Okay. Then I log in as a doctor, then module is my doctor module. In other module, you cannot access this module. You do not have permission to view this page. You can set user rules for each user. Then I am a doctor, then doctor module, outpatient. Then you can see the patient of the doctor. This is a registration number, permanent. Then this is a visited number. Then click the OPD number. And the doctor can diagnose, medication, complaint, vital sign, patient history, discharge summary. Okay, we proceed to diagnosis. The doctor can add diagnosis of the patient. Okay, for example is asthma. Remarks. Then save. Add another. Okay. You can add as long as a patient has a diagnosis. Then you can print here. The print preview. This is the output. Okay. Then we proceed to medication. Add medication for the patient. Category, anti-allergic, atropine, number of days to take the medication. For example, it's 5 days. How many? 10 instruction. Okay, sorry. Advice. Then click save. Okay, here. print. Complain. Then complain of the patient. Back pain. Okay. Remarks. Okay. Okay. Vital sign. Vital sign. Sorry. Okay. Add vital tayo. Remove. Okay. Add vital parameters. Date and time that take vital parameters. Pulse rate, blood pressure, temperature. This is a sample only. Click save. Okay. Then another day, you can add vital parameters again. Sample 26. This is sample only. Yan. Then print. Patient history. Allergies, warning, social history, family history, personal history, past medical history. Then if the patient is okay for the diagnosis of the consultant doctor, the patient can discharge summary. Reason for admission, condition, improved, recovered, expired, transferred, admitting, final diagnosis, clinical findings, course in the ward, and then click save. Okay. Now, I make sign out, then I can sign in as a admin again. Okay. I log in as system administrator and I have access to the doctor module outpatient, but the patient is not visible to my account because I am a not consultant doctor. And okay, we proceed to IPD. Admit patient. Then you can see the master data of the patient. Search for the Marisa Absalon, then click admit. After admit, IPD registration module, then click department. Sample is ophthalmology. No. This is sample only. Breast screening, doctor in charge. Okay, room name and bed name. We can proceed to admission master. Click general ward. Okay, you can see the status of the room based on room type. Okay, general ward, then status, occupied bed, unoccupied. We click all to see all the room available. Here is ground floor, room 101, type general ward, total number of beds 3, occupied beds 2, and unoccupied beds 1. Click status, and below you can see the bed number 1, 2, 3, patient admitted, then admit here. So room name 101, bed name is number 2. Sorry. Provisional diagnosis and complaint, then click save. Okay. So the patient is successfully admitted to the hospital or clinic. Then his or her doctor is Dr. George Gonzalez again. So Dr. George Gonzalez is logging in sa system. Okay. So, proceed to doctor module and I login is as a doctor. Inpatient. Search the patient. Okay. Here. Click the IPD number or visited number. Just like outpatient module, but there's a mini module in the IPD. Progress note. Sorry. Diagnosis. Medication. Complaint. Progress note of the patient. Then prepared by. So module progress note indicate who is the in charge user or add progress note of the patient. Okay. Intake output record. You can also add a record for the intake and output. And print, and also print the result. And nurse progress note here. Prepared by is Miss Tina Nataya, is a nurse of the hospital. He add focus and notes to patient. Okay. Vital sign. Just like our PD module. IP room transfer. Here is the summary of the patient history room. On July 23, he admitted a general ward. Okay, 101 room and bed number 1. Prepared by Miss Jason Pesio Sarino. Then transfer in July 24 in the operation theater. And the reason why he is or she transferred. And you can transfer patient again. Bedside procedure. Bedside procedure is the services provided by the hospital. For example, ward. Where is the ward? Okay, ward services. Okay, no data. For example, admission. Okay. Okay. Then operation theater. Operation theater module is like a surgery or operation to patient. Then from date, time to date and time. Operation name. What operation that can take the patient, diagnosis and name of surgeon, anesthesia, assistant name, operation procedure and notes. Then click save. Then you can print. You can print the module. Okay. Patient history. Just like OPD module. Then discharge summary. After that, if the patient is discharged, we will back to administrator. Administrator has a fully access of the system, of the entire system. Here, billing. Now we can proceed to billing module, so the patient can make payment of his bill. So proceed to billing, POS. Okay. The system is developed by Bootstrap and PHP. So we can access the system through cell phone or tablet. Just is the advantage of the Bootstrap, Twitter Bootstrap template. Okay. Here is the POS billing. Date, invoice number, total items, total amount, and remarks. So we can add a patient here. Marisa. No. Ramon. Select Ramon. Then after click the patient, add item, we can add the particular category of the billing. Example, particular bills, consultant, general consultation. Then automatically rate can show based on the item. Okay. Notes, then click add. Okay. Then if the patient has a record, we will back to dashboard. Then okay, look for Ramon. In the billing, I have a one-click build module, meaning all the patient take, medication, IP room transfer, room rates, bedside. In one click, the system can automatically generate the build of the patient. Okay, here you can see atropine medication, atropine quantity 10, rate 25, amount until promethazine again pronounce it. Okay. Room transfer, general ward, room 101, you can see rate, and operation room and the other fee. Then after that, just save transaction. Okay. Then payment, OR number, total amount 52,200. Oh, this just so big. Okay, never mind. Oh, sorry. Hospital registration fees 500. We can update one, then save. Yay. Payment, then amount paid 25, save. Okay, the patient is fully paid of his bill. We can print invoice here, print preview, customer, and remit payment to, invoice number and date, total. And we can print receipt. Okay, that is how billing module completed. Now we can proceed to room management. So patient management is finished. Then we can proceed to room management. Room inquiry. In this module, we can inquire the entire room of the hospital and where is the occupied or what is the vacant room. Sample general ward status. You can see the patient admitted in the bed, status occupied, patient number, patient name, date admitted. Then room category, we can add category of the room. Room master, floor nya, room type, room rates, room bed master. Okay. Nurse module, the system has a nurse module. Then nurse module has access of patient medication, intake, nurse, vital sign, bedside, IP room, patient story, and discharge summary. EMR sheet, outpatient EMR. EMR sheet and patient management is very different, but EMR sheet cannot add or update the information of the patient. EMR has a print button only and not add button. Okay. Just viewing of the patient. Okay. Now we can proceed to user management. User management is the user of the entire system. We can add new user, assign department and designation, and her rules to system. Here is the rules. Okay. Administrator and CEO, minimal supervision, billing, cashier, doctor, nurse, receptionist, and super admin. And if we can click the doctor or nurse rules, you can see the system page, the system. For example, is bill group name. Okay, the nurse has no access in the bill group name, billing history, billing module. He has access to the nurse module. Oh, bedside procedure update. Okay. That is how the system is very security. Okay. Administrator. Administrator module is the brain of the system. We can add department master, designation, can modify bill group name, particular bill, and we can add particular bill group name, admission charges, particular name. For example is admission charges, for example is entry. Okay. Amount, then click save. Oh, description field is required. Save. Okay. Now if you search the admission, or the admission will can view category name and description. Okay. Complaint master, diagnosis master, insurance company, and other medicine. Category, medicine category, drug name master. Okay. System parameters. We can add a gender, type of gender, um, for example is gay. Yeah. Just click delete if you have. Okay, civil status, title name, religion, blood type, discount reason, type of medicine, medicine UM, payment type, condition upon discharge another. So we finish in the administrator module. We can proceed to reports generation. Patient master report list. All the master of the system. Ayan. Individual patient report. Here. Okay. Individual patient reports is the reports of the patient. You can view where and when she visited in the hospital. Just like Ramon Butchong. Type OPD, date visited July 24, doctor, department. Then after that, July 23, IPD, so on. Okay. And outpatient report. All the outpatient of the hospital. Then also admitted and discharged patient. And daily sales report. Okay. Invoice number, date, patient name, and amount. And total amount. Okay. And also user profile. You can view your profile or update profile. Update your information, personal information, contact information, profile picture. Okay. Then you can change password. And that's it. That is the web-based hospital management system. Okay. If you have a question, suggestion, clarifying, just visit to my official website and contact me. Contact number is my email address. Okay. Thank you very much for listening. God bless.